so that's good. So I'll introduce Dr. Rothwell. He is the Dean of the College of Dentistry, and he has had quite a major lead role in organizing and securing grants and funding and being able to start the planning for the possible future training of dental therapists again in Saskatchewan. So I'll hand it over to you. And if you have a PowerPoint or something, Kenton can put it up. If you're just going to talk to us, that's fine too, whatever you want.
Thank you, Leslie. I'm mostly just going to talk to you.
Yeah,
We
that's fine.
are really early in the planning process, and so we don't have a lot of resources organized yet, but we are working on those. So as Leslie's already said, I'm really glad to let everybody know, for those who don't know, that we were successful in putting together a coalition and applying to Indigenous Services Canada to receive some seed money to develop a full proposal. So I'm not here today talking to you about the new dental therapy program that we are going to be implementing. I'm talking to you about the proposal that we're developing to implement the dental therapy program. The details of that proposal and what implementation might look like are still very preliminary. It's only been about 5 or 6 weeks since we received the funding from ISC, and no final decisions whatsoever are in yet. But there's been a lot of discussion. We did put in an initial proposal to Indigenous Services Canada, which was sufficient for them to give us the seed money. And so I'll tell you some of the discussions that we've been having up to this point. Excuse me. It's pollen time at the cottage. I'm at the cottage, and all of the pollen is coming off the birch trees right now. And so I apologize if I cough and sputter a few times along the way. So the coalition that we have put together is comprised of the University of Saskatchewan, Sask Polytechnic, and NIFA, the Northern Intertribal Health Authority. Those three partners together have put in the proposal to put in a request to develop a proposal to Indigenous Services Canada. That's not saying that those three partners will be the only ones involved in the delivery once we get to that point of a dental therapy program. There will be many more partners in that, hopefully including Northlands College, the Sask Health Authority, certainly the Saskatchewan government, and others as well, other First Nation organizations. What we are working towards right now, what it looks like it will end up being, is a 3-year executive style training program. So it will be 6 semesters of training. Those 6 semesters will happen in 2 consecutive years, where the students go pretty much all 12 months. But that ends up being the equivalent of 3 years of university training. And with that, we will be able to give a Bachelor of Science in dental therapy. The bachelor's degree having the advantage of the fact that it then gives a career ladder for people who are interested in going on to other types of training. And I'm just trying to find my right document here. For being able to go on and do advanced training. I'm just thinking, with a master's degree or with a bachelor's degree, you can go on to do a master's, you can go on to do a number of different things like that. We are talking about changing the way that the school runs from what the former National School of Dental Therapy did. We are talking about reasonably similar type scope of practice, things that the dental therapists will do. Updated, of course, that was school's been closed long enough that it needs a very major update to what people do, but just updated for time. We're talking about a very similar scope of practice. Delivered in a 3-campus model. Rather than having all of the students together, we are talking about doing 3 campuses, one in a southern area of Saskatchewan, one in the middle of Saskatchewan. And by the middle, I mean in probably Prince Albert, being as Prince Albert for people in the south is the gateway to the north, and for people in the north, it's the gateway to the south. So we will call that Central Saskatchewan, and one campus in Northern Saskatchewan, and that is to make sure that we're supporting people from all three sort of areas with the ability to train somewhere similar to where you live. Each of those three campuses, we're talking about establishing only a 7-chair clinic rather than 21 chairs all in one site. It will be 7 chairs in each of the sites. Those 7 chairs will serve both as the preclinical training site and the clinical training site by being able to, attach your mannequin to your dentiform typodont to the chair and do your preclinical training, or take that off and put a patient into the chair for the clinical care training. For instructors, we're talking about having 2 dental therapist instructors in each of those locations. 1 or 2 support staff. I can't see it working with less than 2, but 1 or 2 support staff. And then supplementing that staff and clinical instructors with existing instructors, both in the College of Dentistry and in Sask Polytechnic's dental assisting and dental hygiene programs. And they have dental therapists who are instructors in their dental hygiene program. So those instructors would supplement the ones that would be on site, the 2 dental therapists that would be on site in each place. We are talking about a distance education model. And so the 3 campus sites, the instructors on the 3 campus sites will take turns being the instructor who's teaching in any classroom. So their students, when it's their turn, just for example, in the northern classroom, when it's the instructor is assigned their topics to teach or their courses to teach, their students will sit in the classroom. And the students in the other 2 campuses will watch virtually that lecture going on with a camera showing them and projecting their image to the site where the instructor is. So the instructor will sit and will have 7 students in there, and depending on what they're teaching, they could even have 14 students in their classroom. They'll have a big computer monitor beside them that will show the students in the other campus sites. And so any student will be able to ask live questions of the instructor at the time that they want to ask those questions. And of course, at one time, this was considered to be cutting edge, but now this is how all education in all post-secondary is occurring. So we've developed a tremendous amount of expertise in doing that sort of thing. Will make the proposed dental therapy program much easier. Of course, after that class, students go off to their lab or clinic, and then they come in usually to a second class, and it will be a different instructor on a different campus who will lead, and students from the other campuses will then be virtual, and you can see how they rotate through. And that's also the way that we will be able to integrate the instructors from the University of Saskatchewan as well as Sask Poly in the appropriate parts. Our student body, I've already said, will be an intake of 7 students per campus per year. And of course, being 2 years in the BSc, the 6th semester training, that means a total of 14 students per campus, taking in 21 students a year across the 3 campuses. So a total, I'll do some quick dentist math here, 42 students in total, if things work out exactly the way we want. The admission into the program will be direct from high school. That doesn't mean everybody has to come from high school. That just means there will be no advanced training beyond high school that's needed. You can apply 4 years after you graduate high school. Just the high school will be the requirement to be eligible to apply. We will have minimum eligibility criteria, minimum average types of courses that you have to teach, and we'll make sure that that information gets to all of the schools and the guidance counselors and everybody, so that students can prepare a little bit ahead of time and be ready to come in. I don't anticipate that those entry criteria will be onerous, but they will be high enough to ensure that the students that we accept will be successful in the program. Well, will have the abilities to be successful in the program. Success is up to individual effort as well, obviously. We are right now intending to limit intake into the program in the first year to Indigenous students only. That, of course, will depend on having a sufficient number of applicants who meet the minimum criteria, but we are not anticipating any problem with that. And so we're hoping to have a 100% Indigenous intake into the first year of the program. With that, and this is not at all yet detailed, and so I will just give you the idea, we want different Indigenous communities and different organizations to be able to sponsor seats in the program. And so how that will look exactly, we're not sure, but the idea is that a Indigenous community that knows they want to train one of their community members to become a dental therapist, to return and be the primary oral health provider in that community, can give us the name of the student that they are interested in. They make their own arrangements with the student. Perhaps they pay the tuition. That is a fairly traditional model. And there is a signed agreement between the student and the community that that student is required to go back and give service to the community for a specified period of time. Now, we do have in our rollout plan drafting agreements that could be considered by communities or could be modified by communities to their own special interest. But we very much have that in mind. And we're not limiting this to First Nation communities. So there are Métis communities, there are organizations, there are Inuit organizations, and we would never want to exclude the opportunity for a health authority or for Health Canada or for someone else who has a need to speak with us on this. And so the details of that yet to come, but the intent is to try to do our very best with the training to take in the students that will help to meet the needs of the various communities. Now we are anticipating, as with any educational program that starts with young students, and knowing the history with dental therapy training in the past and knowing that this will be an intensive program, we are anticipating that there will be some degree of a discontinuation rate for students. So everybody who works in Indigenous communities knows that there's all kinds, the social responsibility is different in some of these communities. And when there's a death in the family, sometimes the young ones are called up to play a role in the family that someone in my family wouldn't do. But we realize that different cultures lead their lives differently. And so these people are required to step out of the program along the way. And so I'm going to talk about that from two perspectives. One is, when they step out of the program, that leaves an open space in the program, depending on when they leave. So if they leave after just one term, after 2 or 3 terms, our intent when that happens, when there is a discontinuation, is to fill all of those open seats in second year by bringing in people who have an appropriate degree of training that they can enter somewhere near the start of the second year and only have 3 terms left of the program. And so the intent is to fill those openings, those discontinuation spots with dental hygienists. We will, of course, target Indigenous dental hygienists for their application, but we're also aware that application pool is not huge. And so we are anticipating there will be a significant number of non-Indigenous dental hygienists brought into the program, and this would give them the opportunity to graduate with dual credentials. They wouldn't be together. It would be a dental hygiene credential from the past and a dental therapy credential going forward. There would be some sort of an assessment of prior knowledge and abilities as at the beginning with the acceptance, and probably a little bit of a gap training program. We haven't gotten that far in the details, but most people know that the dental school runs a program like that for foreign trained dentists, where we bring in dentists trained in other countries. They join into the third year of our program theoretically, but they do a very intensive 6-week program before they start the third year. And so some sort of a model like that would ensure that the dental hygienists, they've got excellent skills in their scope of practice, but would have less handpiece types of, just as one example, types of practice in a preclinical setting. So there would be some of that to ensure that some of those hand skill things are taught. But of course, we realize we're training them, we're giving them to people who already have advanced hand skills. So the degree and the duration of that, I'm not sure of yet, but there will be something. So the career ladder, let me see if I can find my document here. There we are. So this is the only place where I'm going to share my screen. I'll do that in just a second. So talking about discontinuations, there's another side to that. One side is filling in those spots by bringing in dental hygienists. The other side of that is I've always I've not been a fan of the fact that in almost all of our health educational programs, there's a single toggle switch. You either make it all the way through and you get your degree and you can go and practice, or you get nothing at all. I don't like that model. I've always been very much in favor of a ladder model, or what I like to call a multi-entry, multi-exit model. And so this has been a pet project of mine. I can't even tell you for how long, for 12 to 15 years. And I'm just thrilled that we're finally starting to move forward and work on the logistics of getting this in place. The vision for this is a student who starts the dental therapy program and is able to get through one semester of the program, who has to drop out for family reasons or any other reason, doesn't have to be for family reasons, that person shouldn't leave empty-handed. One semester of training, if it's lined up properly, is enough to give a credential as, for example, as a dental aide. Okay, so one semester, 3 to 4 months of training would be sufficient. So our job in putting together this proposal is to line up the curriculum so that when you're going through that first year of dental therapy training, that by the time you're finished the first term, you've gotten everything that somebody would need to learn to be a dental aide. Okay. If you get through 3 terms that are not able to continue on into the second year, we want to line up the curriculum so that those students get everything that they need to be credentialed as a dental assistant. Now, it's not quite that simple, because dental assisting requires an externship or a practicum placement. And so they would have to complete that practicum placement as a separate step. So there are some logistics in it, but the idea is if you can make the first year of the program, do that little bit of extra externship, you should be able to come out with a dental assisting certificate. Then if you complete the entire program, you get your dental therapy bachelor's degree. That bachelor's degree allows you to go on and apply for programs like the Masters in Public Health. There's lots of other master's programs that you can apply for. I just happen to like the public health one because so many of our dental therapists are our senior administrators in organized dentistry across Canada. I would love to see them have that opportunity to take the training in organized dentistry, organized dental care that you get as part of doing a master's in public health. So they'd be able to continue on there. And I'd really like to see us set up a model where they could also then apply for dentistry. At our college, we require a 3 years of university training, and a 3-year bachelor's degree, to me, should be adequate. There are a few accreditation requirements that we have to meet with that. So there would probably be a year of psychology and English and all of those things that are part of dentistry's accreditation. But you shouldn't have to start over at square one again to apply for dentistry. So we're hoping somewhere along the way that this also links to masters like public health and also to dentistry, like we have in our program, where you then come in and you don't have to start over at square one again. First year of dentistry is a lot of training about oral hygiene instruction and all of the things that people would already know. So we want to give a little credit for that. So I'm now going to share my screen. Now, I talked about a lot of things that are not part of our proposal. So this is what the proposal currently is looking at doing. So as I said, direct from high school, 6 terms of training to become a dental therapist. If you leave after term 1, we're currently looking at 3 different models of what type of dental aid. And we're only going to do 1. We're not going to do 3. But so we're undecided yet which of these will be the biggest need, and we have to meet with some partners to figure that out. Term 2, perhaps as like a chair side, the old phase 1 dental assistant sort of a model. If you do the 3 terms, dental assisting, these people, I didn't mention this, they can also come back later and rejoin about where they left off with a bit of a prior learning assessment, et cetera. And then that's where our dental hygienists can join the model. Potentially a dental assistant joining here and continuing on forward to dental therapist. Now you see I don't have any lines going off to a master's or to dentistry yet, because that is not part of this program or this proposal that we're developing. But it is part of my personal vision for where I'd like to see this go. And maybe we'll establish a total new model of what the training looks like within all of the oral health professions. A major part of what we're doing and planning is to ensure that the program has accreditation. That was one of the challenges that the previous program and its graduates always faced, even, in my opinion, even if they didn't know that they were facing it. But the lack of uniform ability to license across the country, a whole bunch of other things, is at least partially related to accreditation. And so this program will be accredited, or we won't be running the program. We have 3 different options to move forward with accreditation. And I can tell you, I've already had the first meeting with the accrediting body, and things are looking very positive for going forward with that. I already talked about the scope of practice, and then I'll now go on and tell you about the 10,000 other things that we're talking about in developing a project of this magnitude. And I say that facetiously. Obviously, there's only so much you can talk about. I think that I have hit all of the major areas. And so what I will do is put the floor back over to Leslie, and I'm happy to field any questions that people have about the thoughts. I don't mind suggestions, so questions or suggestions. And please just remember, a lot of this is absolutely up in the air still right now, and subject to a lot of discussion, a lot more meetings, and a lot more thought. But that gives you the general direction that we're moving forward with right now. So I'm willing to take any questions that Leslie says we have enough time to do.
Yep, I think we have time for questions. Does anybody have any questions? Or need something clarified that Dr. Brothwell mentioned?
Fraser here. Hi. I just wanted to ask you a question about sponsorship and how and when that would work, Dr. Brothwell. So for example, I've worked with Battle River Treaty 6 Health Center, and I think that would be an organization that would be very interested in sponsoring a candidate, or maybe even more than one candidate. And I'm just wondering maybe a little bit more about when those organizations are going to be approached and how that will work.
Yeah, so the organizations would only be approached. Is this Fraser? Is this Dr. Glenn?
Yeah, Dr. Glenn, yeah.
Yes, it is, yeah.
Of course, I can't see who's speaking, so thanks, Fraser. Yeah, the organizations will only be approached when we get to the stage of moving to the development of the program, right? So after approval of our proposal, getting the funding that we need, we're estimating about $3 million to funding will be needed to establish the program. So there's a bunch of steps. Once that is done, then we anticipate doing a really wide mailing and communication to all of the organizations that we envision being interested, and we'll give them an invitation to take that forward to anyone that we haven't connected with. But the example that you gave is exactly what we have in mind. So it could be a First Nation entity, but it doesn't have to be. There are lots of entities, health authorities, all that sort of thing across Canada, as well as in Saskatchewan, that we would be interested in helping us to identify candidates who can be successful in the program and who will go back and fill a need that has been identified. And so that would work out just ideally, Fraser. And by the way, this program will be for students across Canada. So we will be accepting these types of things from organizations and communities across Canada as well. And we are also open to establishing additional campus sites under the exact model that I've told you about here. 7-chair campus sites, 2 instructors. They would be given access to the curriculum. They would take their turn in the teaching, and the credential would come out of the partnership. We're working on a dual credential, Sask Poly and the University of Saskatchewan.
Thanks, Doug.
Hope I answered your question.
There's a question in the chat. Would a registered dental assistant be able to become a dental therapist in a year if they were to join this program?
Well, that's another question beyond what we're doing so far. So there is some potential, I would think, for us to have an intake spot for licensed, for registered dental assistants. It would not be the same spot that the hygienists join because the hygienists have the additional training. So it would probably be one stage earlier in the curriculum. We've not yet, the little map I showed you shows them joining after 2 semesters with a prior learning assessment and a gap training session there, and probably of just a few weeks. So somewhere in there, potentially in the future, we could fill some of those spots with dental assistants as well. Now, the program is too small to be available for every single dental assistant who's interested in moving on, but it could be one of the intakes. And so my answer for you right now is we are talking about it, and details will come in the future as we do our very best to be everything for everybody. But of course, then you end up being nothing, right? So we're going to try to do a really good job of what we propose. I do think this will be one of those opportunities.
Thank you. Any other questions or clarifications? Okay, so hearing nothing, thank you very much, Dr. Rothwell. That was that's the second time I've heard that, and I always think if how magnificent this is. It's really addressed all the issues that there have been in the past, and provided a lot more options and variety and support than has been there in the past as well. So I, as an old dental therapist, I've worked 47 years and I've always been connected to dentistry in some way. I really do hope and wish that you're successful in your planning and able to continue on with this and actually implement it. It'll be quite unique model and definitely needed. And so I wish you well in that.
Thank you, Leslie. Greatly appreciate that. By the way, it's very nice to see you again. I haven't seen you since well before COVID.
Yeah, long time.
And how did you start as a dental therapist at 10 years old?
Oh, yeah, right. I wish, no. I was
right.
18. I just worked a long time. Thank
I
you,
wish I
Dr.
could stay.
Barthrow.
Yeah,
Thank
I wish
you.
I could stay for the rest of the meeting, but I've got other commitments, so I'm going to let you continue on.
That's
Bye
fine.
now.
Thank you for your time. Yeah, we
Bye.
appreciate that. Okay, so that was very interesting. So moving on. I don't know, Shannon Freeman was going to be speaking with us from Battle River Treaty 6 Health Center. I don't know if she's joined us. I see there is a phone number there. I'm not sure if that's her. But if Shannon has not joined us, I do know that Fraser Glenn is with us. And Fraser, would you be able to do a bit of an update? I know things have changed quite a bit in Battle River Treaty 6, but if you could just give us an update as to where things are at, people would probably appreciate that. Thank you.
Sure, I will. And just to confirm that Shannon's not here, I did text her and have forwarded all the information on to the staff at Battle River. I was hoping that they would be at the meeting, but hi, everybody. So for Battle River Treaty 6 Health Center, there have been a lot of changes over the last about a year to 2 years, and leading up till the end of March, we've had some of the communities that we have been serving have withdrawn for various reasons and are providing services on their own. So the organization as a whole is restructured considerably. And that restructuring has resulted in the not the amalgamation of 4 departments into other departments. So for example, community health and home care have become merged into one large department. A dental program has become part of what's now called the Healthy Families Program. And that includes Head Start and daycare and other programs serving children in the communities. Health promotion has been amalgamated into other departments, as has human resources. So 4 of the directors of Battle River Treaty 6 Health Center, including myself, have retired. And the rest of the programs are moving on to serve 4 communities: Little Pine, Poundmaker, Sweetgrass, and Lucky Man. For the last year, because of COVID, all of the staff have been very busy with activities related to COVID, and recently in particular, they have been involved in vaccination clinics and testing clinics extensively and almost full time. When I texted Shannon, she mentioned that she worked on the weekend on Saturday. So they're sort of on call a fair bit to serve in the communities, and they've been doing that for quite a long time. We have had some restart to our dental program, but because of the other activities related to serving the needs of the communities with regard to getting vaccinations and testing, most of their time has been used for that. We do have clinics set up and ready to go, but we really anticipate that the full dental program will start again in September, presuming that everything else related to the pandemic has settled down a little bit, and we can move ahead with starting to have normal activities in dental clinics. We've got all the dental clinics set up appropriately for the COVID restrictions related to practice, and so the staff is hoping to go ahead. Having said that, I'm now retired. I'm not part of Battle River Treaty 6 Health Center at the moment. I am connected in terms of dental oversight, but at the moment with no dental program, that's really just kind of in name, in essence, really only. But I may in the future be part of the organization with respect to a dental contract or whatever. I'm not sure. But the dental staff are looking forward to moving ahead, and they will have a dental therapist supervisor, I think probably by June or July, and presumably go into full operation in the fall. So I think that's it. If there's any questions, let me know. Thanks.
Okay, thanks, Fraser, for that. Any questions for Fraser? Okay, so moving on to the College of Dental Surgeons of Saskatchewan. I know Jared is not with us today, but Dr. Uswak, are you able to provide an update, please?
Absolutely. So the big efforts of late have been with respect to COVID testing, COVID immunizations, and we've worked in concert with the other oral health professions, which is the only way that we got some relief to get all oral health professionals added to the priority list for priority immunization. Although with the time it took, a lot of those fell in and got immunized by age, but we were successful with the other groups to convince the ministry to add us to the priority list. Rapid testing in dental clinics was a request made of us by the ministry for collecting data over time. That turned into I was going to say shit show, but that's inappropriate. But what the hell? It's a Monday. We had all kinds of pushback from CDSBI, and not specifically CDSBI, but the reinsurer Aviva, because Aviva's angry with dentistry because they had to pay out, practice interruption insurance due to COVID. So even though that the ministry changed the legislation to make dentists, dental hygienists, and other practitioners able to do this rapid testing, including German Shepherd dogs, Aviva didn't, they still wanted more proof, which I don't know, would take a miracle from one of the accepted deities that whatever people pray to. That was finally late last week. We put the ministry together with Aviva and CDSBI, and it seems like now they're fine and they will sign off on this being added to scope of practice and covered under malpractice insurance. Now the trick is to, despite what SHA has been saying, to actually get the bottleneck of applications from dental clinics to get sent the 9-page contract to sign and get in queue for receiving the rapid testing supplies. So those are the two sort of really major pertinent ones that we seem to have brought closure to. And then further down the road, there is a process to open up the Dental Disciplines Act, specifically Section 25 of the DDA, to enable all of the oral health professions to be independent practitioners. That is, to no longer have, as it is outlined in the DDA, that solid line between dentist and other oral healthcare practitioners. So as this is going, it looks like the process will enable any oral healthcare practitioner to create their own clinic and work as an independent contractor without that solid line to a dentist. So we support this process, and our main goal there is to work with the other oral health professions to ensure that we have consistent benchmarks for regulating oral healthcare professionals in the province. So those are the three big topics of late that we've worked on.
Any questions or discussion from anybody? Okay, thank you, Dr. Uswak, for presenting that information. Dentura Society of Saskatchewan, Kelly and Craig, are you still with us for an update?
I am available, yes, thank you. And good morning, everyone. Greetings on behalf of the Dentura Society of Saskatchewan. We're currently at 67 licensed members in Saskatchewan, 2 non-practicing and 2 interns. Despite losing provincial government funding in 2018 for the 2 Dentura's technology seats at NAIT and Edmonton, The number of practitioners returned to Saskatchewan seems to equal our attrition rate. Most Saskatchewan students train in Alberta and choose to challenge their licensing exams and return to Saskatchewan through labor mobility. If they return to Saskatchewan as a student, they must undergo a period of practical study before challenging the exam. In Alberta, they are eligible to write upon graduation. So we're pleased to report that efforts are underway towards a national exam to define and implement minimum educational standards in the national exam process. There are 6 schools across Canada in which the length of study and the accreditation status vary. Each province must decide on how to properly deal with graduates with differing amounts of education and experience. The DSS has laid out a policy for students graduating from each program to ensure that they have similar qualifications before taking the exam. With the pandemic, the regulatory bodies for the denturists have now come together to form a working group currently known as Canadian Alliance of Regulators of Denturism, also known as CARD, which has been a move in a very positive direction. Our national association is currently conducting a survey for denturists across the country regarding services for remote populations. The goal of the survey is to determine how well serviced these areas are and how they work together with third-party government programs to improve access to treatment. The survey also touches on demographics and general oral health of the patients in these remote areas. In October of last year, we signed a new contract with the Ministry of Health for the Supplementary Health Program for 3 years. We utilized an online survey tool to get information and guidance from our members during the negotiation process. This moved to be very successful in providing the ministry with accurate answers and involving our whole group in the decision-making process. Moving forward, we are hoping to continue our strong relationship with the ministry and look to try expanding the number of procedures approved by supplementary health to allow for more thorough patient care. We appreciate the chance to provide this short update and are welcoming any questions you may have.
Actually, I have a question. It's Leslie. What is the attrition rate on average for denturists in Saskatchewan?
Craig, could you chime in on this one? Since as registrar, you might have a bit more feedback than I do.
So last year was an unusual year, again, with being COVID, but we did have 5 members retire. And that's normally we're at about, 1 or 2 per year. But I think, some of the guys that were, close to looking at retiring and then with COVID, they just, decided to retire. So, but yeah, it's usually 1 or 2 per year.
That's interesting work you're doing on the national level. Are there any other questions from anybody or discussion? Okay, thank you very much, Kelly and Craig. Moving on, Indigenous Services Canada, Megan Catcher, update.
Sorry, thanks. I'll take myself off mute. Good morning. I sent a slide. I'm not sure if it got
Kenton
sent.
has it. Kenton, do you want to put this photo up?
Even better. I'm so not technical.
Yeah, no, he can do it. He's got it. Just it might take him a sec to get.
Sure.
There we go. Can we make it
Great.
full screen at all possible? So we love to see you as well, Megan, but if we could see the picture better, might be good while you're talking to it.
That's all good.
Excellent.
Good morning. What a year it has been for Indigenous Services Canada. I'm Megan Ketcher, the acting dental team lead for ISC. And I started, just to give you some perspective, about 2 months pre-COVID. So my role as the acting dental team lead has been COVID person, not really a dental team lead. When the pandemic hit, we have not been traveling out to community and still are not traveling out to First Nations community for dental purposes. That being said, we've been kept very busy. Our COHI coordinators have been supporting our COHI aides out in all 72 First Nations community. We're still accepting reporting, filling out orders if they're wanting to make oral health packages to give to people. We had a little oral virtual seminar for all of our COHI aides back in February. And of course, just connecting through teleconferences and virtual ways as such. However, for the most part, we are helping our region exclusively with COVID, sorry. In the fall, we've kind of divided up our team based on people's comfort levels, kind of what they wanted to do, and maybe proximity of where they live. Members of our dental team who are all over the province are either supporting with PPE supports for all of the nurses in the region, providing all the PPE for the clinics. Some are doing data entry for all the immunizations, because of course we're entering all the records of immunization. Some are contact tracing. We have a group that are swabbing and have been out in the community swabbing since kind of late October. And then of course, most recently administering vaccine. This includes transporting the vaccine, because as you know, that is a whole orchestrated event, especially with the Pfizer. And we can't just send it out and leave it out there for days and days. So every couple days we have people traveling all over the province to deliver vaccine. We've been trained to do, of course, all the reconstitution of the Pfizer, screening the patients, and then of course immunizing ourselves. Our dental therapists who are immunizing took a 20-hour education on the immunization, and then as well did the 5 modules that the SHA has put out for all non-traditional immunizers. And then of course we were paired up with experienced immunizers to have some hands-on training and get signed off appropriately. So on my slide just kind of captures a little bit in some of the pictures and that sort of things that we're doing. Again, contact tracing, lots of support with the nurses, helping them. As many of you I'm sure are aware, our nurses are stretched so thin, and our dental therapists have really gone above and beyond, being really their right-hand man, woman, person. Our PPE expertise and IPC has just, I don't know, I guess been really shone. We've taught a lot of nurses, maybe you'd say, a lot about PPE and IPC, which we're saying is one of our big strengths. Of course, the nasopharyngeal swabs, we're doing tons of home visits. I don't have the picture on the slide, but I have a beautiful picture of -52 weather of me out with a ski helmet on and the whole, can't even recognize me, but drive-through testing, home visits, and then of course at the health center. Again, lots of training and really collaborating with a lot of our communities and health directors and nurses. And then relieving some of the administration burden that are on the nurses. Some of our dental therapists feel very comfortable doing all of the paperwork and getting all the prep work stuff for the specimens. And then I also was able to get everyone access to look up health card numbers, which sounds like an easy task, but we did have to jump through a few hoops, but it's been very helpful for the whole process, especially now with the vaccine. And then in the middle is that's one of our dental therapists, Penny Griffin, who works for the SHA as well as us. And that's myself immunizing her. So a dental therapist immunizing a dental therapist, which we thought was pretty cool. We've been out in the communities, of course, helping with immunization clinics, and then the urban clinics, Battleford Agency Tribal here in North Battleford has one. And then I've also been at the STC Saskatoon Tribal clinic at the SaskTel Center in Saskatoon. So very, very busy. I can't remember the last day I've actually worked from home. So this is really nice to have a computer screen in front of me. Lots of coordinating schedules and that sort of thing. Of course, we're super excited and anxious to somehow get back into dental at some point here. Like Fraser kind of mentioned, perhaps the fall. But I tell all of the members of our team, because everyone's kind of pitched in and learned new skills and helped out, that we're just kind of too good at what we're doing. I just don't know how we're going to flip right back to dental. No, but in all seriousness, trying to really relay the positive on what dental has brought for help, particular to Indigenous Services Canada, really providing a huge layer of support for the nurses. So that is all I kind of wanted to say. And again, we're continuing to help or to support communities as virtually as we can, and definitely, you know, if anyone's interested in the dental program or COHI and that sort of stuff, our two COHI coordinators, Vivian Moracity, Victoria Lukey, and then myself, you know, definitely do reach out and help as much as we can from afar. Any questions?
I just have a comment, Megan. One of the jobs that the dental staff took over early on, and they're on the line now, I see, so they can chime in. But was to look after PPE and pandemic supplies for Battle River Treaty 6 Health Center, and Indigenous Health has been a great support for us, and directly Penny Griffith. So we really appreciate everything that you've done in that regard. Thanks.
Awesome. So good to hear. Another thing I just kind of wanted to mention, when I've been interviewed a couple times from national, you know, just they're really curious on how we're helping with pandemic and how we kind of got into this whole, I mean, sometimes it seems surreal what we're kind of doing. But one of the things that I kind of mentioned is that, you know, we as dental professionals are very used to working with anxious adults and kids coming into the dental office, or even just opening mouths. And so it's funny how that's translated over to all of our swabbing and people who are maybe anxious about, you know, being swabbed or immunized, vaccinated. You know, it's funny, all these little skills that we kind of took for granted or didn't even realize that we're a huge asset that could really help in this pandemic world. So, and then like you said, Fraser, the PPE, they're often asking us for for our opinions on PPE, because we're kind of one of the ones that have always worn masks and are very familiar with the PPE stuff.
Any other questions for Megan? You've been very, very busy, that's for sure. We actually have a dental assistant who's doing, she's deployed to do testing. And what she's found is that not only just exactly what you've mentioned, but the fact is she's a dental assistant in the Enhanced Preventive Dental Services program. So therefore she's used to being mobile and taking things here and there and just setting up from kind of scratch and just, you know, making it work. And that is quite a skill set in and of itself. And so people are appreciative of that. Yeah.
Leslie, I have one more question for Megan.
Yes.
Just curious,
Yes,
how many, I'm just curious how many dental therapists are immunizing?
We have about 6 who have been fully, 7 actually as of last week, who have been fully signed off. And the way that has kind of rolled out again is to do with comfort level and to do with proximity. Our province is very different from the north to the south as far as supports required or needed, or even maybe even wanting dental supports. So yeah, about 7 we have on a rotation, and a lot of times we're testing maybe in the mornings and vaccinating in the afternoon, or going in and out among the both. So they're really kind of hand in hand.
Are they primarily in the northern part of the province?
Most of our supports are in the north,
yeah.
Particularly the Battlefords area. Battlefords and like Prince Albert area, yeah. Right. And then our ISK nurses in kind of in between that whole, yeah.
Great, thanks.
Any other questions for Megan?
Yeah, I just have one question. Megan, now
Yeah.
you mentioned the 6 or 7 now are doing immunizations, but do you have any idea, and just for my own sake, how many would be involved in the testing, running samples, contact tracing? Are all the ISC dental therapists involved in that?
Not all of the ISC are physically swabbing. The same ones that are vaccinating are the same ones that are swabbing right now. So I'd say 7. The others may be in community, but maybe doing the paperwork and the looking at numbers and the supports in different ways, just because they don't feel comfortable swabbing. And then others are delivering the vaccines and that sort of thing, and that might be their primary role for that day is doing trips like that. So yeah, right now it's just the 7, I believe. There might be 8.
Any other questions for Megan? Okay, thank you, Megan. Hearing none, we'll move on to the Saskatchewan Dental Assistants Association update from Brenda Youngworth. And Brenda is new for our group, so you'll have to introduce yourself, Brenda, because I don't know you either, other than talking to you on the phone.
Yes, I've chatted with many of the faces on the screen. Brenda Youngworth, I started with the Saskatchewan Dental Assistants Association last October. So in the middle of the year of change that everybody else has been speaking about, we added a bit more change to that process in moving our office. One of the first tasks I was given by council was to locate some office space in Regina. So toward the end of November, the office moved from Kenaston, where it had been over 30 years, to Regina. For anyone who's interested, we're in joint office space. We're on Broad Street. It's 307 845 Broad. And just for landmarks, we're a block north of where the Wholesale Club is. So we're fairly easy to find. We were able to, by switching to a VoIP service provider, keep the Kenaston phone numbers. So we have the same phone number and fax number that we had previously. So with the office move, we had 3 staff who were in Kenaston who no longer or ended their employment with us. So we have a new office manager, Christina Kenny, and pardon me, she basically started and helped us initially with our annual registration process, kept things moving. And then in April, Christina Furchuk joined our team as the clinical coordinator. So we appreciate the patience and the grace we've received from some of the members as we've been going through and reviewing some of the policies and the practices. With all of the COVID restrictions, one of the big things missing, I think, for our members was that ability to get together for training or just even to connect. So we've spent a fair bit of time working on providing some virtual professional development opportunities for our members. The presentations we've had roughly 2 a month up to the month of April, and looking at sort of all areas, whether it's clinical practice, self-care, ethics, just a variety of topics that the members are really looking for information on. Also, some of the topics are based on the number of questions or inquiries that we get. So trying to provide some support when people are feeling somewhat isolated. The virtual education piece has also come up nationally at the NDAEB table, with the majority of dental assisting programs in the country having a large component of their training available online now. And the discussion is sounding like they will be looking at continuing some of those practices even once things start opening up. Again, there have been some positive learnings, and it's been a good experience. The labor mobility agreement that was mentioned earlier is something else that has been discussed with the registrars across all the provinces and territories. We seem to have, we don't know if it's because of COVID, we're expecting it may have something to do with it, but a number of people moving from province to province, whether it's for family reasons or employment reasons, economic, what have you. So we've been having a lot of discussion around the, to confirm that we all sort of have the same levels of requirement, skills requirement as members are applying to move from province to province. There's also been a number in several provinces of dental assistants who have lapsed for a significant number of years, 10 to 20, and are wanting to come back. So we're also working across all those jurisdictions to make sure we've got the same requirements in place for each jurisdiction as we look at bringing some of those people back. So for statistics, the final membership stats for 2020, for full practice members, we had 1,262. Restricted practice members were 4. Temporary restricted practice was 43. Those would be the individuals who newly completed their training and had not yet passed the NDAB exam. Non-practice members, 202, and with a grand total of 1,500 members for 2020. We ended up with 93 new registrants in that past year. So I'd just like to close by thanking both the other oral health regulators. Craig mentioned it in the previous meeting. It's been an absolutely wonderful group to work with. I've really appreciated the time and the discussions that we've had, as well as the dental assisting program heads, both Dean and Kelly, as we've been talking about sort of where we're at and how we can collaborate and move forward. So it's been great to be part of those progressive teams. So I don't know if anyone has any questions, but thanks for the opportunity.
Any questions for Brenda or clarifications? Okay, thank you, Brenda. That was very interesting. I always learn a lot in these updates. So Saskatchewan Dental Therapists Association, Cindy, can you do your update now?
Sure. Did you want to do a hygiene first, Leslie, or?
Oh,
I can go ahead.
sorry. You go ahead and we'll go back. I took my glasses off for 1 second and look what happens.
Okay.
Go ahead. We'll go back to hygienist.
Thank
Sorry.
you.
Sorry,
No,
Shelby.
thank you. I just want to say I hope everybody and their families are staying safe and healthy. A few of my things that I was going to talk about have come off my list, so that's perfect. Our stats are we have 191 registered members with 172 practicing members. And yeah, it's very exciting to hear Dr. Rothwell, and I've heard about his vision, and it's good that it's finally coming to fruition. We are, of course, lacking members. We too lost a few more members than we expected for COVID. Like most actual health professions in the province, most of our members are kind of on the older side. So we've got some retirements coming up. So I'm glad in a few years there's going to be some new members to take their places. With regards to this COVID, we have been working closely with the other professions, other dental health professions, and working on some protocol for our members. And we are on phase 5. That was in December, came out in December, and it's still our active phase that we're going with. And you can find that in all of the dental professions websites. There will be a link to it. So. And my next thing on the list was just talking about the role dental therapists have been playing in the COVID, and Megan is fantastically taken that all out of my list now. So I'm very proud of the profession. I know 10, 13 years ago when H1N1 was here, we talked about the role that dental therapists could play when it comes to a pandemic. And I should say dental professions can play when in the role of a pandemic. And it's great that it's actually coming true. So all these years later. Because in February, of course, that amendment was made to the Disease Control Act to allow dental therapists to be able to do that. Like I said, everything on my list is kind of going out. Yeah, so ISC and dental therapists are now providing those immunizations. Anyways, on May 8th, SDTA held its 47th annual conference and annual general meeting. In the morning, Vera Horn spoke on oral facial myofunctional therapy. I think a lot of people have heard Vera before, but I never get tired of hearing her speak. She was absolutely wonderful. We had fantastic feedback from that. And just to note that Vera started her career as a dental therapist coming out of Wascana, and then went on to become a therapist, and then went on and moved to Alberta and started her practice in oral facial myofunctional therapy. Following that portion, the speaker portion of the day, we had our annual general meeting. Dr. Doug Rothwell spoke on dental therapy in Canada, and Dr. Todd Hartsfield spoke on dental therapy in the US. And a lot of people will remember Dr. Hartsfield because he taught at Wascana, he was part of the Saskatchewan Health Dental Plan, he taught at the National School of Dental Therapy, he was a consulting dentist for some of the northern organizations. So, and now he's in the States, and me and him talk from time to time, and he updates me on what's happening in the US. The whole day was a great day. We had a lot of positive feedback from everyone. We're still working on our foreign qualification recognition program. We've been happy to work with immigration and career training in the province, and we've had been able to get grants through them. So that's been great. Some of the modules that have been developed are stainless steel crown, rubber dam, posterior composites, permanent extractions, pulp therapy, pit and fissure sealants, radiographs, ethics and jurisprudence, impressions, space maintenance. So a lot of things have been done, and now we'll move into our next stage where we can see if we can get those online, and we're looking at partnerships with other institutions to have that done. We still have our parents' guides, Lift the Lip pamphlets, and Walk with Charlie Chu booklets. They're still available through our office. We've made an update to the parents' guide, so it'll have just a little bit different look. It's blue now, and it's got some updated pictures and whatnot. So it's still a very good book. Yeah, I guess that's about it. That's kind of taken everything. So anyway, so the best news is we're looking ahead to possibly having a dental therapy program. So it's pretty exciting. So.
Any questions for Cindy or clarifications? I like that you have the banner up in the background. That's nice to see. Get some use out of it. That's good.
Yeah. It's not going anywhere. So.
True enough.
We've had all of our council meetings through more or less through Zoom meetings, and it's been good. It's actually worked really, really well. But and it was our second AGM held through Zoom. But there's a lot to be said for in person too, and just liaisoning with people and some brainstorming on ideas and stuff like that. Some of that stuff you just can't do through Zoom, but it has worked out quite well.
I have one question, if I could, for Cindy. Hi, Cindy, it's Fraser. While we're waiting for a dental therapy program in Canada, are we getting any dental therapists? Are we getting any dental therapists coming into Canada, in Saskatchewan or elsewhere from the States? And
from the States, no. From the US, no. In the US, actually, the Alaska program for dental therapists, we do accept that program. So it would be nice to have some people apply from there because we do accept that program. Most of the other programs in the US, and they're very, very few, are kind of designed a little bit differently. It's kind of more of a hygiene therapy program and that type of thing. And we really haven't had anybody apply, and we would have to go through the program and kind of look at everything. There is a school, hopefully will be opening up in the next year or 2 years in Washington that hopefully will be based on the Alaska program too. So it would be a good fit for graduates from that program to come to Saskatchewan.
Okay, thanks.
But we have had a lot of interest in from other countries around the world, and it's nice to be able. It's the gap training now. Some of those programs just don't have some of the training that we have, and that we find necessary in this country. So that's where the curriculums that were developed are going to be very important. Some of them aren't, well, we won't require them, but they will be there, but some of them are required.
Any other questions for Cindy? Okay, thank you, Cindy. Going back, Saskatchewan Dental Hygienists Association, Shelby, I'm sorry I jumped ahead.
No worries. Hi, everyone. My name's Shelby Ham, and I was recently appointed the registrar of the SDHA on effective December 1st, 2020. However, I've been with the organization for a couple of years as deputy registrar. And the SDHA just relocated our office, but within Saskatoon from 8th Street to 3rd Avenue, the corner of 25th and 3rd. So the SDHA has a current membership of 680 registered dental hygienists, which is very consistent with our statistics from 2020. Nationally, there was some concern based on a 3-year forecast that the pandemic would really impact the appeal of the profession. However, our short-term results are that we're consistent with registrants from years past nationally. And dental hygiene continues to be a sought after profession, and we are seeing a lot of job postings come to our job board. We currently have 35 listings on our job board, and those are only open for about 3 months. So those are very current job postings that are in demand for. The SDHA has made minimal deviations for the eligibility for application and renewal due to the pandemic. We have allowed for a potential extension of a required local anesthetic module for applicants that have graduated outside of Saskatchewan or jurisdictions that have local anesthetic in their education program. And our national board exam has moved to an online proctoring. So those are the 2 major changes that have happened related to registration and renewal. The Federation of Dental Hygienists of Canada are undertaking a large project to renew and update the national competencies related to entry level to practice for dental hygiene. The project is currently in its approval phase, and we have a steering committee presenting across the country to councils for approval. And we hope to move the project into an endorsement this summer and into implementation shortly after that with our key stakeholders. The SDHA held a virtual conference and AGM, our second virtual AGM, much like the others, in March. We had approximately 225 attendees, and our topics were very perio-driven. We had repairing the periodontal foundation, a review of the periodontal classifications, and ultrasonics and navigating best practice. And during our AGM, we had 3 new council members join us: Leanne Juveneres, Lisa Pollack, and Tessa Creary. Our national association, CDHA, has developed national standards for oral health care in long-term care facilities, and we'll be looking at stakeholders here provincially to help implement some of the strategies in that document if there's interest. Dental hygienists are continuing to uphold the interim IPC protocols that were last updated in December in conjunction with the CDSS's interim guidance. And our council confirmed support for the Government of Saskatchewan's amendments to the disease control regulations, which enable the COVID response plan, naming dental hygienists to be auxiliary vaccinators. Uptake for this is unknown. We do have a couple pathways on our website through the SHA and ISC for dental hygienists to be recruited for this. What we have seen is a number of dental hygienists that have been contract employed by Alberta Health Services for remote COVID case managers. And we have a strategy with them, with the College of Registered Dental Hygienists of Alberta, of how to license them in Alberta through SDHA. The SDHA worked jointly with the other Saskatchewan oral health professions related to the vaccine rollout strategy to be inclusive of oral health professions. That was discussed earlier, and I would like to thank the others. We worked really well together, and it was a lot of back and forth and meetings to get that to happen. So we were all very pleased, and we worked quickly to get those eligibility letters out when it became effective to our registrants. We continue to provide response to the government related to the submission related to the Dental Disciplines Act in Section 25. And we look forward to seeing applications from Sask Poly's well-respected 3-year dental hygiene program this summer, and look forward to opportunities to meet with you all in person, hopefully soon. Any questions?
Okay, thank you, Shelby. That was very interesting as well. Moving on to the Saskatchewan Health Authority, we have a few updates from some of the integrated areas. So starting with the integrated Southwest, Jennifer Patulli, I think you're on now. Would you like to do your update, please?
Yes, that'd be great. Thanks, Leslie. So I'm just gonna start with the fact that so over the last year, we had one of our dental assistants go on maternity leave and another dental assistant came on. It was interesting to see that once that term position was up, they decided to keep that dental assistant on because they could see the skills that she was bringing to the public health team and just the versatility that she brought, which was great. And I think that's something that Megan had also stated. So initially things had kind of, our programming had come to a pause, and so they had redeployed the dental staff to do some help with negative calls, go data entry, and everything in between, to be honest. And so we did see a temporary reestablishment of the dental programming from about September to December, which we were really hopeful that we would see that continue on. However, with the way the fall went and there being more cases of COVID, they did decide to pause that dental programming again. And then once that occurred, we saw that dental assistant whose term was then up move into home health monitoring. Also in the Southwest, one of the DHEs was moved into home health monitoring. So that team helps or assists the public health nurses in enrolling and monitoring positive cases across the province. They also they review the daily interviews that are submitted by all the positive folks, and then they connect them with resources that they may need to assist with their illness. So there's a lot to that position, and I'm happy to see that they've just in the Southwest here taken up some of the dental staff to help with that. Myself and the other dental assistant have been recruited to help with vaccine rollout, not specifically providing the vaccinations. However, I'd be totally on board if they looked at that as an opportunity within SHA. To date, I haven't heard of any dental staff doing that within SHA, but there's still time, and so hopefully we may see that. So the dental assistant helps with the rollout of vaccine in the Moose Jaw area, and I help with the rural vaccine clinics. Again, just echoing the flexibility that the dental staff has brought to the team and have been recognized for. There's ever-changing duties, day by day, sometimes even hour by hour. And so I think we've all just kind of rolled with it, and it has been said that we've been, quite good at that. And so that's something to kind of hang on to. So I think that's all I've got for our area. Looking forward to looking at teeth again.
Any questions for Jen? Okay, so Amy Laliberty is to report for the Integrated Northeast. And I have a report from her because she was unable to attend. So I'll just read her report. So Patricia Skalicki has been hired for the dental health educator for the far Northeast Saskatchewan SHA zone. She has also been appointed a manager position for vaccines for 6 months. Amy Laliberty will be taking her DHE position temporarily for the 6 months starting on March 17th. Rhonda Cranky has been hired for Patricia's senior dental therapist position. Congratulations to all. Our dental programs have been essentially suspended completely, so our staff have been utilized in almost 100% COVID efforts. We have supported contact monitoring, staff and client screening and vaccine clinic support. We have also been trained to perform COVID testing by a nurse educator, which relieved nurses who are testing to aid in other areas of the COVID setting. We have all been taking the immunization training for COVID vaccines and hope to utilize our skills with administering the vaccine. We have continued to promote oral health by handing out toothbrushing and home fluoride kits. We updated a current provider list with COVID information for families who normally rely on our program for dental services. We have been keeping up with our continuing education credits by taking online courses, webinars, and most recently, some of us have attended the Saskatchewan Dental Therapists Association conference that was held virtually on May 8th. We have been working with a decreased capacity. We currently have 2 dental assistant vacancies. We are counting the days when we can be back into our dental health roles, which hopefully there is light at the end of the tunnel with vaccines. We will continue to aid in the fight against COVID wherever we are needed. And that's respectfully submitted by Amy Lalo-Bertie, the dental therapist. She is a dental therapist. So that's what she had to say. She's had to say. And next on the list is Kelly Fuchs to
Good
provide
morning.
an update from Regina Urban. Yep, good morning.
Good morning. This is Kelly Fuchs, Senior Health Educator in the Regina area for the Saskatchewan Health Authority. Like some of the previous updates, all staff in former RQ have been redeployed out to various COVID response positions. There are 5 of us, and since March of 2020, staff has been redeployed to testing and assessment sites, the drive-through, and public health. So we've all done various positions such as, COVID swabbing, admin, screening, contact tracing, case investigation, negative calls. We've pretty much ran the gamut, and I think everyone's been really good at being so versatile and having shifts change and locations change. I know some of the staff has even been involved in mobile testing or on-site testing at various locations. Like all dental professionals, though, I think we're all excited to find out when we get to return to dental work, as we have been not suspended, but our program has been 100% on hold since the start of the pandemic. So I don't have much to report, except that I think I speak for all of the team in Regina when I say it, the opportunity to work so closely with so many different people in so many different disciplines and, some kind of high stress situations here and there has been really rewarding to get to know a lot of different people. And although there's been some ups and downs, I think overall it's been a positive experience. I think that's about it. We're just waiting to get back to teeth and hoping for the beginning that comes after the end of the pandemic. Thank you.
That's a good way to put that, the beginning after the end. Yeah, there we go. Any questions for Kelly? Okay, we'll move on to Saskatoon Urban. Carrie, do you want to do your update now?
Sure. I'm Carrie Krieg, and the position I hold as a dental assistant is long-term care oral health coordinator for the Saskatoon area and beyond. I've been able to keep myself very busy, it seems, working from home or sometimes going into the office to find a computer to work at. Our office space at the Adewald Center has been taken over by the CDC program, contract tracers, those employees. I feel privileged to be able to have been able to keep doing my dental work, as so many of you, as I've heard today, have had to do other work than dental. I've been visiting homes who call me for assessments before they can send them out of the long-term care homes to the private practice dentists, as emergencies only were allowed out of the homes during that first year. Now many are going to their dentists, but as you know, many cannot leave their homes. I agree with Megan Ketcher, teaching other health professionals about proper PPE and them coming to me for questions because they know of the expertise in the dental world with PPE. It's very interesting. Leslie has
Looks like we may have lost Carrie.
Oh, okay.
weeks ago, just hear back. Reached several homes in the Saskatoon area, 6 in total, providing teachings with PowerPoints in small settings with social distancing.
Looks like it's a latency issue on her end, or like a connection issue.
Okay, I'm gonna just text her just so she knows. We'll just, I'll text her, but in the meantime, we can maybe.
I
move
think
on.
I'm back
Oh,
now. Am I back?
you're cutting in
I
and
think
out.
I'm back.
You're cutting in and out.
Okay.
Turning off your camera may help.
So turn off your camera, Carrie, and just speak. Just
Not
stop
sure.
video, stop video.
Oh, okay.
And just speak.
All right. Is that better?
Well, we can hear you, so just maybe start from a minute or so ago.
Oh, okay. Did you hear about Leslie had applied a few times for resumption of services for dental teams?
I think that's kind of about where you cut out.
Okay, all right. Yeah, so our third attempt was a few weeks ago. We're waiting to hear back. I've returned to several homes, 6 in total, providing PowerPoint presentations to small group settings in a room large enough for us to join together with, of course, social distancing and masks on. I have provided huddle talks to staff in most of the neighborhoods in those homes. And of course, some hands-on help for many of the residents that have dementia and Alzheimer's, and they're having difficulties with that. It's been wonderful to be able to be there for them. Assisting staff with the OHATs, they've been behind, as you know, everyone else. COVID is the priority and other things get dropped. So it's been great to help them with that as well. I've most recently returned to the home that I started last February, where I had just provided the PowerPoints and had no hands-on training yet for them. So they were happy to have me back last week, and I'm returning again next week. I've been able to provide teaching to the CCA course for both the urban and rural and the Gabriel Demount campus. They've allowed me to come back with the social distancing. I've made a connection with instructors of the first year nursing program with Polytechnic, and I provided through WebEx teachings on oral health. Also, I've made more connections with the Northwest area with the nurse educators in long-term care and sent them PowerPoints for teachings on end-of-life care as well. I've been working with the continuing care aid department along with Leslie to arrange for dentistry to return to long-term care. We've set up audits in the homes that were providing space for the dental teams pre-COVID. And I've attended audits with the IPAC team and the special projects team in continuing care to find spaces that will be safe for residents and the care team and the oral care teams. We made lists of changes that are needed, and the IPAC team is actually making up a work standard that will be given to each one of the homes. And I've been invited to the director of care meeting for all the long-term care homes in the Saskatoon area this week on Thursday to present this work standard to them so that they're able to be ready to go when the dental teams can return to long-term care. And that's about it. Any questions?
And for Saskatoon Urban, in addition to Carrie, I will state that our 2 dental clinics resumed service in July, August of last year. So that's our White Buffalo Youth Lodge and West Twins Primary Healthcare Center. They've been seeing kids again, following all the, whatever the current protocol is, we've been following that. We did update our HVAC systems, and at West Twins, we actually built in a separate entrance to the clinic, and that's our PPE room. So we have kind of a pre-operatory space that we go through now to get into the clinic, which is nice. Our fluoride varnish that occurs at well baby clinics, that resumed also in July and August and has continued on, again following all the appropriate protocols. And staff that have worked in the schools doing the dental sealant fluoride varnish program. One of them is doing admin work with the testing and assessment sites, and the other one is doing a lot of testing and assessments. And other staff are basically doing, like, updating all of our policies and standard work and PowerPoints. And we've been quite far behind in that, so it's kind of nice to catch up in that. And then also with I guess the change in all the Saskatchewan Health Authority, all the out-of-scope managers' portfolios have all changed. And I've now accepted a portfolio in Saskatoon Urban. And it does include the dental public health work and also includes the Saskatchewan Bleeding Disorder Program. And I'm also now, in addition to that, the acting manager for immunization in Saskatoon Urban. And that is the regular school CHC kind of immunization. And the manager who is actually, that is her portfolio that she accepted. She is the COVID immunization manager. So I'm a busy person. I don't have any time to twiddle my thumbs, that's for sure. And there was a question in the chat, and I'm not sure when it came up, but it was about when will there be resumption of services plans, which in Saskatchewan Health Authority, that's what we have to do in order to get a service back that has been reduced. And so, again, most of ours have been re-implemented, but we still do need to have a resumption of services plan for enhanced preventive dental services, which is the dental sealant fluoride varnish component of the work that we all do in SHA. And I'm actually working on a submission for that, hopefully that will go in June. And it's, keeping our fingers crossed that we will be allowed back in schools at some point and we'll be able to continue on doing that work in schools, but that may not happen right away. So I would like to propose to the powers that be, that would make the decision for us anyways, that we have a community hub model where we have so many of our at-risk schools be brought by their parents or guardians or whoever to a community hub where they would get those same services, again, following all the protocols that are in place. So anyways, there is some work that needs to be done with that. In SHA, it's not going to be just a matter of, oh, well, you can go back to work and do everything, you're back in the schools doing those programs. We will have to put in place resumption of services plans for all of our areas in SHA in order to resume that service. And just before I leave SHA, I did notice that Ellen and Kara Brown are on. And if you wanted to do a quick update, I didn't put you on the agenda, but if you wanted to do a quick update about what's going on in Northwest or Southwest in the Rosetown area, just let me know and we can have you do a bit of an update if you'd like to.
Leslie, it's Jen. I had a question about your hub model. Would that be just for folks that are in those high-risk schools to access the dental sealant program, or would they have ability to access any other services dental-wise there, like fillings and stuff like that is what I mean?
Yeah, no. So in the hub model, no, it would basically be the same function as the dental sealant fluoride varnish assessment referral program. And if we found children that needed to be referred, we would still be referring them to White Buffalo or West Winds Dental Clinic. So we'd be only still focusing on non-aerosol generating procedures in doing that work.
Thank you.
Ellen or Kara, did you want to do a quick update? I know it puts you on the spot. You haven't had time to think, but if you wanted to add something different, maybe that you're doing that hasn't been mentioned, feel free to, or you can put it in the chat if you'd like to do that as well. That's fine. Okay, so moving on, Saskatchewan Polytechnic Dean, who's now the dental program head. Dean, do you want to do your update for Saskatchewan Polytechnic?
Yes, thank you, Leslie, and good morning, everyone. I'd like to first acknowledge that I'm providing this report on Treaty 4 territory and homeland of the Métis people. And just to give you some information on the positional changes that have happened within our organization. So Sharman Waranowski, our past program head, she assumed the academic chair role in July of 2020. And I was asked to assume the program head position, which I accepted in August of 2020. We presently have an interim Dean of Health Sciences, Dan McKay, that is serving us, as well an Associate Dean, Phoebe DeSimone, that has just been hired, that will be assuming her position as Associate Dean of Health Sciences next month. So just tracing back to when COVID hit here in March, our program was suspended, and as a result of the backlog that was created with both our dental assisting and dental hygiene students, the tough decision to suspend the dental assisting program was made, again, because of that backlog and the fact that we had to undertake a major renovation to our clinics where we provide care and training for our students. So that is well underway, and I'll talk a little bit more about that as well. But 14 out of our 25 dental hygiene students from 2020, our year 3 graduating class, they returned in August, in early August, where they did finish the rest of their clinical requirements. And they were the first graduating class of our new 3-year program for the dental hygiene advanced diploma program. Our dental assisting students, we had 59 of them. They did return as well in early August and completed the rest of their clinical requirements as well as their practical experience at the end of December. We have been very busy, as I mentioned, with the renovations to comply with the new COVID-19 protocols. And what we are looking at is creating enclosed operatories in 2 of our wings of our clinics. And that is well underway right now. So we were able to secure some government funding, and we have been working with our industry partners to help subsidize some of the costs associated with that. So we have been working with our donor and alumni department quite a bit in securing additional funds. And our grand vision is to completely renovate the whole floor where our clinic is located, including our preclinical area and our reception area. So a lot of work has been done in, planning this new clinic that we're really excited about, and it is on track right now, and it is planned to be completed by the beginning of August so that we can restore our programming. And the dental assisting program is coming back. Applicants have been sent out their acceptance letters, as well as our first-year dental hygiene students. So we will be accepting the full 65 dental assisting students. That will start on August 30th of this year, and our hygiene students as well. So when COVID hit, of course, we had to pivot very quickly. And as a result of that, we did transition into online learning. And I want to give a shout out to my amazing faculty who transitioned, and we moved courses and moved up that online content until we were approved to go back. Last week, because of the outbreak in Regina, we did return back to campus, but that was after another 6-week delay. So our present year 3 students, our graduates from 2021 here, are catching up with all the lost clinics. And again, faculty and staff have been amazing in working evenings and weekends to recover some of those lost clinics. And we also, again, with the new restrictions, have pivoted with our community oral health project. So unfortunately, when COVID hit in March, we were planning to have our traditional dental day, which is now named Health and Wellness Day. And that was supposed to happen on the Saturday, and our campus was shut down on the Wednesday. So it just happened before that. But our students did do a lot of community outreach into high-risk groups virtually, and those that were allowed to attend in person were able to do so. We were able to secure a grant from the Forbes Foundation for $7,500, where we were able to use some of that money to supply oral care aids to these vulnerable groups, again, scattered throughout Saskatchewan, depending on where our students chose to work with. And we have also partnered with the Regina Open Door Society, the Regina Food Bank, the North Central Regina Family Center, Phoenix Residential Group, and Mother Teresa Middle School, where we are providing subsidized or free dental hygiene care, because we are running our dental hygiene clinic right now. So that is something that we are utilizing as well. And as far as the continuing education programs, we are restoring that. Our focus right now is to recover some of the lost clinics right now with our day program, so that our current dental hygiene grads are not delayed any further, but we are running our continuing education courses on weekends and times that are available, because essentially we're down to one clinic because the other two clinics are being renovated right now. So there's a lot of work being done to get that continuing ed course pushed through. So for example, this long weekend coming up here is when our dental hygiene local anesthetic course will be running. And then we are also running our orthodontic module and our retraction cord and our reentry programs in the dental assisting program. So very busy at Saskatchewan Polytechnic, and yeah, we look forward to returning and providing service in a brand new, exciting clinic.
That does sound very nice. It's always nice to have the renovation done, because it happens like once every 30 years or whatever in an institution. It's always lovely. Yeah, I know that the College of Dentistry is undergoing a renovation too, so that's well needed there as well. Are there any questions for Dean?
And sorry, I should also report, just to build upon Dr. Brothwell's comment there with the dental therapy program, is I haven't attended any meetings in regards to this. This is something, again, that is fairly new. We are having a meeting within the next week where I will be able to learn more about this process. But yeah, there's nothing to report on that end other than what he had reported already from Saskatchewan Polytechnic. But we are one of the partners that are working through this process. So really preliminary and early stages right now.
All right, thank you, Dean. Saskatoon Council on Aging, Mercedes, can you do your update now, please?
Yes, good morning, everyone.
Morning.
It's my pleasure to provide an update on the Saskatoon Council on Aging, or SCOA, I guess, as it's shortened in ordinary conversation. SCOA is a voluntary, community-based nonprofit organization that supports older adults to stay active, engaged, and informed. And our work is primarily done in the Saskatoon and area. The pandemic has, of course, impacted everyone through the loss of social contact and support, but especially older adults. And SCOA has moved to virtual program delivery in an attempt to reach out and connect with as many older adults as possible through email, social media, computers and devices, and of course, the phone. We have offered instruction, use of computer technology for those who are interested, so they can take part in SCOA webinars, but also to connect with one another and with family. All in-person events, of course, in this past year have been either canceled or postponed. This year, SCOA proudly celebrates its 30th anniversary, and we continue to strive to achieve our vision of positive aging for all in an age-friendly community. This involves constantly challenging, difficult situations and issues that are important to older adults, often diminished and overlooked by those with influence. And these include widespread prejudices of ageism that were greatly exacerbated by the pandemic, adherence to human rights for older adults, protection against elder abuse, maintaining quality of life, and creating a community where voices of older adults are heard. And out of concern for these negative happenings, particularly with older adults in care, that was regularly reported in the news media, last year we prepared a paper entitled Beyond the Pandemic, Reopening Saskatchewan, a call to action for a more age-friendly community, which set out these key issues in detail. The issues are important not only for older adults in care or in hospital or long-term care, but for those outside the healthcare system. The paper envisioned a special seniors task team to bring together experts on aging, including older adults, to consider the short and long-term impacts of the pandemic and to identify policy solutions for the future. And that paper is on our website. Our website is www.scoa.ca if you wish to access it. Subsequently, we were fortunate to receive a New Horizons grant, and we are now preparing to proceed with this research. We met recently with the Minister for Seniors, the Honorable Edward Hindley, and were encouraged by his interest in the project, in receiving regular reports, and of course, findings and recommendations. We continue to promote age-friendly communities and offer an age-friendly lens to any business or organization wishing to determine whether it is age-friendly or not. And it can be accessed from our website.
Mercedes, can I interrupt you for 1 second?
Yes, certainly.
It sounds like something's rubbing against your microphone, like a piece of paper or something. So if you can just keep those things clear of the computer.
Thank you very much. Okay. Over the years, we have worked closely with the City of Saskatoon to encourage application of age-friendly principles to their services and infrastructure, which they have done in many instances. I'm pleased to share that the city received the 2019 Age-Friendly City designation from the provincial government in recognition of the progress made toward becoming an age-friendly city. SCOA is happy to take some credit for that. And it's important to note that if the city is age-friendly to older adults, it is age-friendly to all. We maintain a connection with the SHA, and we'll be meeting soon with the new directors of clinical integration and of primary care. Also, this past year, we met and welcomed the new geriatricians at the Saskatoon hospitals and look forward to further collaboration. SCOA has close to 4,000 members with whom we communicate regularly by email and electronic newsletters. Unfortunately, this does not reach everyone, but that will change hopefully when we can meet face-to-face again. We pass along the latest information from SHA about vaccinations by email and social media. Educational materials on many topics, including a caregiver support service for caregivers, are available in our resource center. While most of the staff has worked from home this past year, there is a receptionist in the office to answer phones and to field questions. SCOA has supported the work of this coalition in the past by sharing its concerns and successes, especially the progress made in improving oral health for residents in long-term care and increased awareness of the importance of oral health to overall health. And it's most important that older adults maintain oral health as they age. We're uniquely positioned to communicate directly with the public about what might improve the quality of life for older people. So let us know if we can help in any way. Tell your older adults about us and check out our newly refurbished website, www.scoa.ca. And our phone number at the Fieldhouse offices is still 306-652-2255. Thank you so much for your attention.
Thank you, Mercedes. Are there any questions for Mercedes? Okay, thank you again. I did reach out to Marcella Ogunchuk, who I see who's in the session, and she is with the University of Saskatchewan College of Nursing, and she did say that she could do a brief update. She thought that it might have some relevance. So Marcella, please take it away with your update.
Good morning. Thanks, Leslie. And I'll make this brief. I am just reporting on what we did in fourth year nursing program. I'm not sure about the other programs. So just to clarify that. We normally are doing oral varnish in the schools. However, although we had all the PPE and everything required, the school division now does not allow taking temperatures of students in the school. And as that was one of the requirements, we did not do any assessments or oral varnish. On the other hand, there was a huge uptake of teachers wanting teaching on toothbrushing, the importance of toothbrushing. And so we did spend an enormous amount of time developing PowerPoints relevant for students from kindergarten to grade 4 on toothbrushing, and many of them were translated into Cree, and many of them were done voiceover and sent to LaLoche School. So I know I'm speaking quickly because I know there's many people, but I've just sort of highlighted what I thought would be relevant.
Would you be able to share any of those resources with the rest of us, or are they available on any website? Or
well, actually, we've just been reusing them and reinventing them, but yeah, we do have them uploaded at the College of Nursing, and I can share them. I guess one final point that is coming out of our research team is that we have just finished developing booklets with the community of LaLoche, with our oral health research we've been doing with them, and finalizing with Thunderchild. So hopefully we'll be able to share that with you as well.
any questions for Marcella? Okay, thank you, Marcella. Glad that you were able to do that on short notice. I'm just going to read in the chat what Ellen Wagner stated. So she did put in the chat that in the Northwest area of the SHA, that they have continued to do teledentistry, mailing out fluoride varnish to recalls, giving OHI and OHI to new clients enrolled in the preschool program. They've lowered the enrollment to new clients to 4 months of age and other children. And I'm hoping to contact my acting manager soon to see when I can resume services. Penny continues to work in the COVID capacity, and Jessica, our dental assistant, has left our program, but we have not yet replaced her. So that's an update as to what they're doing around the North Battleford area. Okay, before we wrap up today, is there anybody else who is on the call who would like to share or do an update? Okay, well, again, another very informative morning of information, and I do look forward to a point in time when we can meet together again. We do have some thoughts in mind for some virtual education sessions between now and the fall. So stay tuned for those. Those would be shorter in nature, maybe an hour and a half, 2 hours. So stay tuned for that. We'll certainly send that out to everybody when we organize that. Thank you for attending today. I hope you did find it helpful. You can use this as continuing education points if you need to collect them and use them towards your profession. And with that, I'll say goodbye and have a nice rest of your day. Get outside. It's going to be hot, hot, hot. Hopefully it'll rain. Bye-bye, everybody.
Bye. Thanks, Leslie.
Thank you, Leslie.
Bye-bye.
Thank you, Leslie.
Thanks, Leslie.
You're all welcome.